Welcome to our webinar today. Thank you all so much for being here. As folks get logged in, I'm going to go ahead and let you all know about some upcoming webinars that we have going on here. On Wednesday, June 16th, we've partnered with the Midwest Center for Occupational Health and Safety for a free webinar on discovering the root of your backstory, understanding and preventing back injuries. And that'll be presented by Dan Neenan and Linda Emanuel, RN. We'll be taking a brief pause for the month of July, so make sure you take a nice vacation. And we'll be back in August, starting August 4th. We've partnered with Stephanie Holm, MD, MPH, and the University of California, San Francisco for a free webinar on wildfire smoke. And for more about these events, you can visit us at coeh@berkeley.edu/about-CE. And on behalf of the education and research centers throughout the country, we're pleased to present the Industrial Hygiene webinar series, offering free webinars the second Tuesday of each month. This collaborative effort is on behalf of each ERC's continuing education program and aspires to provide access to current research supported through NIOSH ERC programs. Really appreciate you being here with us today. Today's webinar, Chemical Exposures and Reproductive Health of Nail Technicians, is brought to you by the University of Utah Rocky Mountain Center for Occupational and Environmental Health and Darrah Sleeth, PhD, MPH, and CIH. A few housekeeping items first. You will be muted during this presentation. If you'd like to ask a question, please enter it into the online Q&A box. We'll save time at the end of the presentation to address as many questions as possible. This presentation is being recorded and will be made available on the Center for Occupational and Environmental Health YouTube page. All participants who logged in with their registration email for the full live presentation today will receive an email tomorrow with a link to an evaluation form that will qualify participants for a certificate of completion worth 1 continuing education contact hour. Once you've completed the evaluation, you'll be able to access and print your certificate. And at this time, it is my absolute pleasure to welcome our presenter for today, Darrah Sleeth, PhD, MPH, and CIH. Dr. Sleeth is Associate Professor at the University of Utah Rocky Mountain Center for Occupational and Environmental Health in the Department of Family and Preventative Medicine. She earned a PhD in Industrial Health and an MPH in Industrial Hygiene and Hazardous Substances from the University of Michigan, as well as a BA in Integrative Biology from the University of California, Berkeley. She is also qualified as a Certified Industrial Hygienist, or CIH. Her research interests include exposure assessment for airborne respiratory hazards, particle size selective sampling methods, and indoor air quality. Her overall research goal is to improve exposure assessment for occupational and environmental stressors in order to keep workers and the community healthy. Thank you so much for joining us today. We're looking forward to your presentation.
Well, thank you, Michelle, and thank you for letting me be here and to present some of our work. I kind of like to think of this as our past, present, and future in this looking at nail technicians and their health and safety, especially chemical exposures and reproductive health. So I'm going to talk about a few of our studies and what we hope to do in the future. Okay, so an introduction. And first of all, cosmetologists are really a broader than just nail technicians. There have been several studies done on this population, which includes hair salon workers, estheticians, and they've shown increased infertility, fetal death, and preterm delivery. So we kind of wanted to break this down into what's affecting nail technicians specifically, because you'll see the population is slightly different than the cosmetologists as a whole. And most of us know that nail polishes, polish removers, polish strengtheners, nail adhesives can contain hazardous chemicals. And there's research in research in this area that I'll present. The main three they talk about the toxic trio are dibutyl phthalate, toluene, and formaldehyde. And you can see that each of these has been associated with reproductive hazards. So developmental toxicants, teratogens, carcinogens, and increase in pregnancy loss. There's also things like methyl methacrylate that we'll talk about, which is also specific for nail polishes. So how are nail technicians sort of different from the overall field of cosmetologists? According to BLS, there's approximately 155,000 manicurists and pedicurists. This doesn't really capture maybe those ancillary workers there, but those are the primary nail technicians we're talking about. And 56% of them are actually Vietnamese. So the majority of them are Vietnamese. A lot of these are immigrants. It's definitely a reproductive age female population. And so that's why reproductive hazards are incredibly important. And there's some health disparities that others have found, especially in the Vietnamese population of nail technicians. And this job is, it's got healthy job growth potential according to BLS. So it's not going away. It's definitely a growing field. So previous studies in terms of health outcomes have found respiratory and skin disorders, elevated risk of cancer, gestational diabetes, placenta previa, again with some specific health disparities. But more specific fertility issues are not really well characterized. So when you look at time to pregnancy, it can be kind of hard to tease out that effect, and things like pregnancy losses. So that's kind of somewhere where we're heading, is to really look at some of these. So there's a few methods when we want to look at the nail technician population. There's a few ways we can target this group. And I'm going to break this into sort of exposure studies and health studies, and talk about a few of them, and then how we can, combine them. So for exposure studies, we typically see, assessment of exposures, characterizing your contaminants. And then associated with that, we can also do interventions where we look at controlling exposures and, the real industrial hygiene, sort of health and safety paradigm there. We have, excuse me. For health studies, we have seen community-based approaches, the real community engagement. There's been mail-in questionnaires. Some of those are maybe targeted specifically to cosmetologists as a whole. And then population-based studies where you're not necessarily dealing directly with people, it's more maybe medical records and population level data. So these are the approaches that we've seen. There's advantages and disadvantages to each of them. In an ideal world, we can combine them and do exposure studies and health studies. And so we're kind of in our group, we're kind of working our way there. You'll see the asterisks. These are some of the studies we're going to talk about that we've taken on. So our first study that I'm going to share with you was an exposure characterization that we did in Utah nail salons. And this was really a partnership with Salt Lake County Health Department in the end. And really, we wanted to see what is in there, what can we find? And this was, 8 or 9 years ago. So, things may have changed, but I think it was really interesting in terms of the methods we had to use and what we found and how that's going to help us moving forward. So the purpose of this study was just to quantify those air contaminants. And we hoped we would be able to do some regression, some modeling, but ultimately we didn't have great power for that. But in terms of what we did, we had a specific inclusion criteria for this. Again, this was just in Salt Lake County, which the population is about 1 million in the county. So the inclusion criteria to be in this study was that the nail salon had to be zoned commercial. So we didn't want home-based businesses to be included. And we wanted it to be just nail salons. So predominant service needed to be nail-related activities. If they did have non-nail related activities, it needed to be lesser impact, occupy less than 20% of the total physical space, and then it had to be separate and enclosed by a door, separate room. So my really wonderful student, Victor Alaves, he was found 189 qualified businesses that fit this criteria in the county. And so we sent an invitation and said, hey, look, we are going to do some free sampling. Do you want to know what's in your air? And it was a flop. So we had 6 people respond. It was really unsuccessful, but beggars can't be choosers. So we went to these interested businesses and we said, what we wanted to see what they were willing to do and what they were like, but it was really clear that there was some major self-selection bias. They were all really high quality buildings. They were, all, Caucasian owners. It was really didn't feel it was a representative sample. So we decided to kind of move directions here. So we decided to partner directly with the county health department. So Victor, he was working there as this is part of his master's project. And talking to them, we realized that, well, these businesses have to be regularly inspected. So I think it's either annually or biannually, they are inspected. And this includes things like ventilation. And so it seemed like this could be a way for us to kind of gain access. And so in this case, they allowed us to come in and set up our sampling equipment on the days that they did their inspections. And so we really were able to get it was a convenient sample, obviously, but it was really random so far as, the inspection date of the given business. There was no real reason to believe that would bias our sample. So whoever was scheduled next for an inspection, that's where we went. So it was a nice way of getting randomization and also an access. But, it is a very top-down approach to that. And I'll talk about some of the limitations of that. So what did we actually sample here? Well, in terms of an air quality, we were limited to area samples. We were able to put a mobile cart at sort of a seated breathing zone height next to what was considered one of the most, the busiest workstations. And we had several measurements that we took. We had an indoor air quality monitor, the Q-Track, that was there the whole time. So these were 8-hour, full shift samples. And so that collected carbon monoxide, carbon dioxide, temperature, and humidity. And then we also used an evacuated canister, so similar to the one that you can see in the picture here, so that we could collect the volatile organic compounds, and those were analyzed using EPA method TO15. So that was kind of the range of VOCs that would be of interest. But then there are also some other chemicals that are not quantified in that method, including methyl methacrylate, methyl acrylate, and formaldehyde, that were specifically, we were concerned about them being present in nail products. So those we had sorbent tubes, which we co-located with the canister, and those were also a full shift sorbent tube sample. So in addition to the quantitative information, we also collected information on the size, the layout, a little bit on the ventilation system, and then the number of workers and customers. And again, we wanted to do some regression using some of that. That was some of the goals, but it also helped determine kind of where to place things in those salons. All right, so what did we end up with? Well, we ended up being able to do 12 salons, and then we ran out of money. So we did 2 of them twice as a control. So one of them was sampled on 2 different days, and then one we had 2 sets of sampling devices on the same day. So that was sort of a way to get a control measurement there. And also you'll see there's 14 samples, but there's only 12 unique salons. All sampling, we decided we were going to limit it to Friday, so that would eliminate any issues with it being more or less busy on different days of the week. So we were able to do it during regular business hours on Fridays, during winter, so that we could assume that they weren't going to be opening their doors for additional ventilation, in the summer. So we were really pleased to see that the demographics were much more representative of what we had anticipated. So we had 9 of the 12 with Asian owners, 2 Caucasian and 1 Hispanic. And in comparison to our voluntary self-selected demographics, it was noticeably more representative. Most of them were relatively small, 2 to 4 technicians working. There was one big, large salon that had 10. And then in terms of some of the building design, about a third of them had direct exhaust to the outside. So only 4 of them, the other 8 would have, recirculating air. So it was indication of ventilation quality there. So then I have some tables of our results. There's a lot of data in all these, but I'll kind of summarize it in a minute. These are our sort of physical descriptors of size. You can see the range in the number of customers from 6 to 72. The volume of the buildings were on average just under 300, but it did range up to 600 cubic meters. And then the number of practices. So these are number of nail stations that were available and pedicure stations and other. And then some of the indoor air quality measurements. Nothing there was really concerning, but you can see where which ones had direct exhaust. And then in terms of some more of the chemical information, you can see they were full shift samples. And there was a few very small measurements of carbon monoxide, most likely related to something in the non-nil specific. You wouldn't really anticipate this. It's probably from furnace and can make combustion. But the one thing that should note is the carbon dioxide. I mean, you anticipate after over 8 hours of people being in a space that the carbon dioxide would increase, and we did see that. And by the end of the day, most of them were over 1,000 parts per million of carbon dioxide. So for ventilation quality, we really want to keep that number under 1,000. And some of them were able to. So salon number 2 was, it was pretty, they were pretty good at ventilation aspect. All right, and then some of the chemicals of concern, and here we did measure a lot of these, but they weren't really hitting much in terms of exposure limits. But you see, acetone has a very high OSHA limit. And the one thing that we were concerned about was the formaldehyde. And you can see that it does have a very low NIOSH recommended exposure limit in comparison to the PEL. And we did, see some exceedance of that NIOSH limit in some of the salons. So we'll talk about that a little bit. Again, then for the MMA, so the methyl methacrylate, which I'm not sure I mentioned, it's been banned in Utah since I think it was 2006. So we shouldn't see any of it. That would be the assumption, but you can see that there were some measurable quantities, again, not hitting any exposure limits, but the fact that it's there suggests either residual sources, or maybe a lack of education and training on the need for different materials. So that was a bit concerning that we did see it in so many of them. I did include the odor threshold on here because I want to talk about that a little bit. You can see some of these have a very low odor threshold. And I think that's a kind of important point to come back to. All right, so kind of the main results that I think are informative here is that, most of the salons, they were hitting this 1,000 parts per million by the end of the day, and this is sort of an indication of, the ventilation system might need to be looked at. Can we try and, if we're going to look at that as a surrogate, and then that might help reduce other exposure potential. We did see the MMA in more than half the salons, And then for the formaldehyde, half of them were over that NIOSH limit. And then we did look at a mixture. So we had, obviously a range of chemicals. So the TO15 method measures quite a few chemicals. We looked at the TLV mixture, and we didn't see anything concerning except when you included the formaldehyde in comparison to the REL. So what are we seeing here? What do we want to take away? Is that, for one, over half the nail salons had a banned product, which was a bit concerning. The formaldehyde was also concerning, but one thing I didn't point out, the control sample was actually relatively high, and that was just taken in a new home. And so we think that had other additional sources. So that was something we were gonna, we wanted to keep on the radar to keep looking at formaldehyde. And then I mentioned the odor thresholds, and I think it's, I think it's helpful to identify how these levels compare to that, because people know you walk by a nail salon, you walk in, you can smell something. And a lot of these chemicals are the odor threshold is very low, but you can smell it, even when it's not probably going to cause any health outcomes. But then, then there becomes sort of maybe even a mental health concern for the workers. Is they can smell it. Is that causing any sort of psychological stress when they can smell it, even though it's not necessarily going to harm them. So that's again something to keep in mind when we do look at health outcomes. Another part of it is that maybe that mental health. All right, so conclusions. We're still concerned about formaldehyde, even though that we're not really concerned about any OSHA limits in this, in these salons. But we did see the MMA, and it does suggest that maybe we do need more education and training, even if it's just residual products there. Was it, did they realize that they were in those products? Were they able to replace them or not? This is something that when we do our future studies, we'll talk about, that being a really important piece that we can do from a health and safety side intervention. And then, as I said, this is really a top-down approach. So it did enable us to have a representative sample. So we got the demographics we wanted, but it did have its limitations. So it was really a passive engagement, which is a little bit unsatisfying from research when it's, they're just letting you in there and the government's coming in to sample. So, that's a little bit of a limitation in terms of being able to do personal sampling, connect, engage with that population. So that's kind of where we're heading to, less of a top-down approach, I think, in how we want to pursue this. So that kind of leads us to our next study, which we have just now kind of finished, and we're writing it up. So these aren't published yet, but they are much more recently collected than those data. So that was a top-down approach to an exposure study. And then we decided, okay, well, how do we get to the workers? How do we really engage with the workers? And, we've been, looking at all the health outcomes, and there's really a really focus on those reproductive health outcomes. It's reproductive age females. We know these chemicals can affect that. So, it seemed like a really important target in terms of a health survey and talking to workers. So the purpose of this next study was to gain a better understanding of the reproductive health outcomes of the nail technicians. So in this case, we used a survey tool to get a cross-sectional sample. It was IRB approved. And actually, it was interesting. We were thinking about how are we going to get these workers? What's the best way we can do it? And I remember somebody very specifically said, wasn't there a list of them? Shouldn't somebody know who is all licensed? And I said, yes, there is. So we went and apparently the Division of Occupational and Professional Licensing has, if you have a contractor, you want to see if they're licensed, you can go and look it up. Well, for nail technicians, it has the same thing. For research, they will actually give you this list of names to contact for research purposes. So that was kind of really exciting that, look, now we have the workers, right? We can just reach them. So turns out there are over 10,000 nail technicians licensed in the state of Utah. And we decided to include both current and former licensed nail technicians because as I'll talk about later, there is, a healthy worker effect that can bias the data. But here, if we can say, okay, you're formally licensed, but maybe you were, maybe you did work for a long time and you had reproductive health outcomes, we want to be able to reach those people too. So that was kind of really powerful from these data. So as this was, again, something of a pilot, we said, okay, well, we don't want to necessarily send everybody something. We got a random selection of 1,000 names to pilot our survey. We wanted to see, one of the major things we wanted to know was what was the response rate of this type of method. So I'm not sure we hadn't really seen many studies use this type of a design in terms of participant recruitment, getting a list of names from the licensing data. So we weren't really sure what our response rate would be. So that was one reason we wanted to pilot it, but also it was something of a new tool for us. So the survey tool, it had been modified from a previously validated fertility survey. And that we kind of tailored it down. We didn't want it to be too big for a pilot. But then we added questions about their work history and work practices. So we wanted to know what kinds of PPE they used, what kind of engineering controls they used, and that sort of thing. That's the industrial hygienist in me is, well, how are they doing their job? That's what I wanted to know. We made it available in English and Vietnamese, and we did have a native speaker who is in the medical field. She validated for us that the translation made sense from that perspective, and we made it fully anonymous so that it was online, right? It was a SurveyMonkey. It was fully anonymous, so there was no IP tracking, but we did offer a drawing to any gift card, so that was the only email address, was the only information that we gathered. But again, so there's some limitations to this design as well that I'll come back to. All right, so how do we analyze these? Well, we were really interested in a lot of the sort of basics of what's the response rate, how did the survey tool work? But obviously we're collecting this data. We wanted to do a bit of regression looking at the relationship between the working career and the number of miscarriages. So what we did, we defined working career as this variable of a possible chemical exposure over your working lifetime. So this was like a surrogate that, obviously has its limitations, but it was sort of kind of the best we could do there. So this included the years worked, hours worked per week, and then use of an exposure control. So based on the hierarchy of controls, we decided that we were going to include the ventilated downdraft table as kind of a yes or no, did you use this in our model, as a high quality engineering control that would suggest you had lower exposure. And it's, it has variable use in nail salons, and that was, validated by our survey as well, which you'll see. We did control for some confounders: age, race, smoking status, drinking status, and household income. So how did the survey get sent? Well, we had over 10,000 technicians, and we randomly selected 1,000. To be licensed, you have to have an address. So we were able to send a postcard to every registered nail technician, and about 90% of those did not get returned sender. We also had 710 emails in that database. And from those, we sent them 3 email reminders. And after the third email, only 38 were still undeliverable. So combining those two, we could see in our population that we were able to reach 937 of those nail technicians one way or the other. So we thought that was, seemed to be a pretty good from that perspective. All right, but then in terms of our response rate, it was about just under 10%. So we had 90 responses. And again, we weren't really sure how this would fall out in terms of response, but it's better, a little bit better than I think we maybe had expected. So that's good. We wanted something, over 50. So the average completion rate was 82, which basically means they got to the end effectively. And it didn't take as long as we thought. So we thought it was going to take 20 minutes. It was only a 12-minute survey, and 94% completed in English and 6% completed it in Vietnamese. So I'm happy to see that effort to translate it did pay off with some additional survey takers. So the demographics of the population were a little bit disappointing. We had an average age of 33.6, again, that reproductive age female, but they were predominantly Caucasian, but then also about 16% Vietnamese. I'll keep in mind that this is the whole state. So our initial exposure study was just in Salt Lake County, which has slightly different demographics, but still, I think we're not quite representative of where we want to be in terms of representing that whole population of nail technicians. And then in terms of an immigrant population, it's really similar to the percentages that you see nationally. So that, again, I think it may be an underestimate of the representation there. So for occupation characteristics, the average number of years worked was 7.8, and they were working on average 25 to 26 hours a week and 4 to 5 clients per day. So, it's sort of maybe on the younger side of the workers, newer workers, and more part-time workers is what is really who we're taking the survey, I think. All right, so what did we see in terms of health outcomes? Well, we saw a relatively high percentage of miscarriages reported. Again, we'll talk about some of the biases and who's taking the survey, but compared to nationally, where you see a 10 to 20%, we saw about 31% of participants who had reported being pregnant experiencing at least one miscarriage. So as I said, 90 people took the survey, and of those, 62 actually reported having been pregnant. So that's where some of these denominators are slightly different. We also saw a higher rate of preterm birth, so babies born less than 37 weeks compared to the national average, and slightly higher rate of birth defects compared to the national average. So again, these are the population may not be representative, but it does give us pause to think about what we can do. So before I talk about some of our future, this industrial hygienist in me again wants to share all the health and safety practices that they found. I find it really interesting to see what's going on in these workplaces. And the most common exposure control that was used by the most number of people for every client was the ventilated downdraft table. You can see in the figure that it was really split. So you had 40% used it for every client and 45% never used one. So it kind of suggests there's a real divide in maybe the quality of engineering design available and the quality of the salon experience there. And you can see one caveat is that these data were collected in just I think November through January of this past year. So during COVID times, Utah, I think, was mostly closed down still then. But I think the way we asked the questions, hopefully that COVID didn't bias it, because we did want to know, like, on average over your entire working career. So this is sort of how we phrase those questions. To kind of get at not just right now, but whatever you normally do. So the least common exposure control, as you might expect, would be a half-face cartridge respirator. So 95% had never used, and I think the other 5% were just declined to answer. Because this is a customer-facing business. It would be you don't really want to, you want to be able to talk to your customer, and those half-face respirators are not really conducive to that kind of interaction, and the optics, as they say, are not very good there. The other types of respiratory protection, they were reported 35% used a surgical mask for every client, and 3% used an N95 mask for every client, which, again, this is people, I think, at this point in time understand what these things are. I would say we did have pictures of them in the survey. So, if you say ventilated downdraft table, what does that mean? We did include a picture for them. But I do think in terms of respirators, people now kind of, they do understand what we're talking about. And it is interesting, the N95, because that is, is for keeping out particles and not gas and vapors. So it's interesting that you do see some people using it for every client, but then there are nail services that require, they do generate some dust. So it's not terribly unsurprising. Another interesting finding was that only 55% of the technicians reported having received any training on how to reduce exposure to chemicals. So this is, again, somewhere where, targeting that education and training, the outreach, community engagement, I think it shows that there is really a need for that, even if it's really simple of, hey, these are some really simple ways to reduce exposure. And you'll see on here, I don't list things like gloves or aprons, and because those were somewhere in the middle. So there were between sort of basically less than 40% of nail technicians used any other type of control measure regularly. All right, so then we did do some regression to see how is this miscarriage related, miscarriage rates related to the working career kind of exposure variable we tried to put together, and we didn't see any. I mean, I will say I think we were slightly underpowered for this with our response rate, and we did look at it two different ways. So miscarriages, it ranged from 0 to 10 in terms of the number, and so we did look at it from both a continuous and a categorical, so either 1 to 10 or yes or no. And we did see, with the alpha of 0.05, it was, getting close to significant, but when we controlled for all our, all these confounding variables, then it was no relationship. But again, we were pretty underpowered. So we're hoping maybe with a bigger sample size, we can see if this this relationship might be more clear. All right, so some discussion on what the limitations here are. Is that obviously there is some selection bias here. Our demographics, again, are not representative. Who is taking these surveys? Obviously it's more part-time workers. We did try to send it on like a later in the evening, different times, and so that you weren't catching somebody at 8 a.m. or 11 a.m. when they were supposed to be at work. We did not measure the exposure directly. So we had this surrogate variable that may or may not be a great estimate. So that sort of tool as a surrogate has not been validated. But I think that's something we can look at is, can we get a better, combine some variables to better get at that exposure. Again, I think it's underpowered. So this shouldn't be a problem if we can go after this whole population of 10,000 nail salon workers. If we can, and this again, I'll get to our future studies, if we can get more representative sample in terms of demographics and what the workers are doing, then I think we should have plenty of power to answer some of these questions, these data. I mentioned the healthy worker effect. I do think we, is a good job of reducing that by including former workers, which I think is a really powerful thing. If if you're going into a nail salon and you're only getting people who are there and who haven't maybe left because they did have issues with their health. And so I think it's really powerful to be able to capture that population as well with this. So some of the conclusions on this, it's going to guide some of our future work. It's clear people don't really trust email surveys. I don't think. We got several responses wondering if this was a scam, including I told you we had a drawing for gift cards, and people, a lot of them just said, "What is this real? Is this a scam?" And I said, "No, you remember taking the survey," and so that's where the community engagement, and people can you have people expecting the survey and do a little bit more marketing on that, which we didn't have really the budget on this to do that kind of marketing. And also in terms of response rates, and again, we didn't really have funds to give everybody a small gift card, but I do think that's probably best practices here. It would be $5 to $10 for filling out the survey is probably going to increase that response rate as well. Another thing I didn't really mention, but I think is really important is this balance between too much and too little information, especially with respect to exposure and health timing. Right. So we have, again, it's a cross-sectional study, so you always have this kind of issue with timing. But is their health outcome, did they have those miscarriages before they ever started working? That timing. Our original survey, we were hoping to capture that, but it was just too onerous, I think, to do it in this for this group. So I think again for the next phase, we really want to get at that timing issue of exposure versus health outcome. And also for our larger study, can we validate this high miscarriage rate? Is that really a real indication of the health burden in this group? Because it appears that would be a very a much higher rate, or is it because our sample is biased by people who are really worried about reproductive health and they see the survey and want to take it, or people who've had miscarriages are more likely to take the survey? And so that's a question that we want to also try and tease out and reduce that bias. All right, so I think I'm going to finish with some future needs here. So we've learned a lot, I think, from these couple of studies, and looking at studies that other people have done, and really, the gold standard is going to be targeted outreach into the community. We have small business associations, especially cosmetology schools. If you're looking for what I mentioned here at the bottom, if you're looking for a cohort, looking at those new workers who haven't had the exposure yet, cosmetology schools is a great place to go, and community and religious groups. And, especially in the Vietnamese community, can you kind of get targeted outreach where the workers are? And this all kind of ties into the total worker health that I know NIOSH has a lot of focus and a lot of, they're putting a lot of emphasis on. And at the University of Utah, we're also really taking this on. I think it fits in really nicely with that. There's, some efforts there with engagement and total worker health that I think are primed for doing. And part of that, again, with the targeted outreach, better understanding of exposures and exposure timing, and being able to understand when when the exposure happened, when the health outcome happened, and does it, can you tease out a relationship better? And that all kind of leads to probably a prospective cohort study where you're following these workers from when they start to, through pregnancies. And that, again, it's really the gold standard for showing relationships and between these things. And so I think that's going to be critical. And so I'm hoping, we're starting to kind of plan some of this and targeting our outreach before we send out our study to everybody, trying to get people primed to do that. So I think it's a really important population that needs to be studied. Like I said, there's some really clear health disparities that other people have found, and I think we've seen. We know there's exposures, we know there's chemicals, and what can we do? And part of it is ultimately, from an industrial hygiene perspective, is what interventions can we do? And I think that's going to be critical, is what interventions work in terms of reducing exposure, getting, people aware and, conscious of how they can help themselves, and have, salon owners, cosmetology schools, can they be involved in kind of promoting that as a really critical part of this community that, they're not going to have industrial hygienists, that's not part of the industry. So I know there's some really great programs in California and in Boston, looking at nail salons. So I'm hoping in Utah, I hope we can kind of also get going on some of these community outreach and engagement things with this community. So, all right, well, that's I think that's all I have. So just wanted to thank the funding. So the NIOSH ERC funding, which supports our students. And we also had a pilot project through the Utah ERC. The University of Utah Department of Family and Preventive Medicine Health Studies Fund also provided support for this. I really want to acknowledge the students that were able to help get taken care of, do the hard work. And then, so other faculty and colleagues who provided assistance and guidance and insight, and our health department colleagues as well. So some references you can look at when you get the slides. And and I'll take any questions. Thank you so much.
Thank you so much for sharing your research with us. And for our attendees, at this point, you are welcome to enter your questions into the online Q&A button, or Q&A box. I recommend putting the question there as opposed to the chat. It's a little bit easier for us to keep track of them. So if you entered a question in the chat, I did try to grab it, but if I miss it, pop it in the Q&A box so we can make sure we get that question answered as well. We do already have a good number of questions in here. I tried to keep track of which ones came in for which studies, but we'll see. For the first question, why weren't PBZ samples collected?
So I guess you mean personal breathing zone. Yeah, we basically, with our using the county health department with their inspections, we didn't really, well, first of all, it would have been a lot more administrative issues with that. And I don't think they basically didn't really want us to interfere with the workers. So it was more of a that's what I meant by passive engagement. We didn't want to be intrusive. We were kind of tailing, on the coattails of them. But that would have been ideal. If we could do it differently, we would absolutely do personal breathing zone samples.
Thank you. Another person has a comment and a question. I would expect them to be more likely to hit the STEL than the PEL due to the nature of the work. Did you measure this, or is this an idea for future work?
Yeah, that's a great question. Yeah, we did not measure any short-term exposures because it is a whole air sample over 8 hours. So we weren't able to with this method, but yeah, absolutely. If there's, if we could use some sort of real-time device in there and look at short-term, that's absolutely a great addition to it.
Thank you. Were the specific tasks fairly consistent from salon to salon?
So it's hard to say. So basically, yes, I think it was mostly manicures and pedicures. There wasn't a whole lot of and acrylics. There wasn't anything really exotic, I think, in terms of what they were doing. We did, I can't remember if we quantified. I think we do have the data on exactly which ones. I didn't show it, but you could see that most of the stations were nail stations versus like pedicure stations. Yeah.
Thank you. Are the OELs relevant for the endpoints of concern you listed?
Well, that's a great question. So like for example, with the TLVs, especially with methyl methacrylate, it actually lists several. So, a lot of these are irritants, right? So those are what a lot of the OELs are based on. But I know for the TLV for methyl methacrylate, they are concerned about other, so pulmonary edema and other endpoints. So I think yeah, I think that's an important question about what levels do they see reproductive hazards. So for example, toluene, what they've seen with the teratogen effects are really for really high levels of toluene, maybe even above those OELs. So yeah, I think it'll probably vary for the different OELs, but that's I think that's definitely an important point.
Thank you. Another question regarding the number of males in your population, and if there were any studies specifically on the males in the population.
No, actually, we didn't. And interestingly, so I will confess that in our survey, we forgot to ask if they were male or female. So we did get at least one response saying that they didn't have a. I can't remember the phrasing, but it was assumed it was to be a male. I can't remember the phrasing, but yeah, so and that was an oversight on our scope. So we don't actually know how many percentage were female, but my guess is that it was probably most. If there may have been one or two males. Yeah, I don't know in the nail salons that we did the exposure study in. I don't think we quantified the gender of the sex of the workers. We just counted them.
Thank you.
Yeah.
Do you know if the owners or employees of the sample sites knew of the hazards associated with exposures to formaldehyde and toluene? If so, what was their source of their knowledge? For example, an OSHA publication on product warning, etc. This commenter noted, it would be interesting to see how much of these salon owners know about the hazards and whether they've taken steps to control them.
Yeah, no, I think that'd be really, that's really important information that, again, we weren't, with the exposure study, we weren't really able to interview the owners or the workers. With our survey, we didn't get into that detail, but I think that is really interesting to see where are they getting their information. Like if they say, okay, if this over half of them had received, some information about how to reduce exposure, was that, did they get that from their friend? Did they get that from their supervisor, right? Where does that information come from? Did they get it from OSHA? No, I think that's kind of an interesting kind of sub question there that we could add. And that's where the interventions like targeting, using the research or the education and training as an intervention. I think that's one point where, you can control what information they're getting compared to when, you don't know where they're getting it. So.
Awesome. Thank you so much. And so thank you to our audience. We continue to have lots of really great questions. So we'll do our best to get to as many as we can during our time together here. How do your results differ in the populations that used versus did not use a ventilated table? Were there any general conclusions that you can infer based on this difference?
Yeah, well, that's a great question too. And we haven't actually looked at that specifically. Like I said, we're still writing up these results of the survey data, but I think that's definitely something we could look at is was that population, is there some difference, in terms of, health outcomes and demographic, was there anything that we can tease out? I think that would be an interesting thing to look at, but we haven't done that yet. But.
Thank you. Did you take a look at or record what nail processes the workers were using, such as polish versus acrylic extensions versus removal? And have you done any research on newer nail products such as polygel or dip powder?
Yeah, that's what. Yeah, so I think it's important to understand, that things have over, even 7-8 years, the industry can change in terms of that. So I think it would be really interesting to see how the products have changed. We didn't specifically, we didn't write down exactly what types of products they were using. I think we did have information on what they were doing, the types. I think we did have that information, but we didn't have specific, brands of products. But yeah, I think that's really, especially with the methyl methacrylate. I mean, maybe now we wouldn't see any, and because things have changed so much, and I think that would be interesting to find out. Yeah.
Excellent, thank you. What about any concerns with UV exposure, other non-ionizing radiation? Was that something that you looked at?
Oh, that's interesting. Yeah, that's not one that we've included. But yeah, I would be interested to see like how much type of UV you might see, or how much it's used. Yeah, that's interesting. We haven't added that. Yeah.
Great, thank you. And for the survey, did you ask about employment status, workplace setting, number of coworkers, or the types of services and products used?
No, so we did not. So this is, again, I think the pilot, we have a lot of questions we had to cut, and a lot of it was were some of these types of questions on really specifics. Like we really wanted to know, like, when did you start working, and what type of a salon was it, and was it home based or not? We started with all those questions and had to kind of tailor it down. But I think especially if we wanted to compare it to any sort of exposure data, I think that's important to be able to quantify, was this person, they're registered as a nail technician, but are they only, doing things in their home? Are they only working, or do they even work at multiple salons and it's different? That's the kind of details that we would hope to collect in the future. Yeah.
Thank you. Yes, there's plenty of avenues for additional considerations.
Yeah.
Given more funding, more time, all of those factors.
Yes.
Lots of great avenues to explore. Thank you so much for your research.
Yeah.
When out at the salons, did you observe absorption risks worth pursuing versus inhalation being a primary route of exposure?
All right. Yeah, that's definitely an issue, especially with like I said, there were responses that most of them did not wear gloves for most of their clients. So I found that interesting. So I don't remember offhand if it obviously didn't stand out to us at the time about it. But for sure, especially when we see that, they're not wearing gloves and they're not, that's definitely something, especially with, looking at specific chemicals and what's the absorption risk for the individual chemicals that are being used. And I think that would be useful to kind of compare and see if that would be, if that could be a part of the risk. And then you're going to, well, maybe we need to take some biological samples and see if what their you know, biological you know, exposures are for you know, blood or what have you. So interesting.
Thank you so much. And we do have someone who wanted to make a comment that one of the things the AIHA is trying to do is teaching the OSHA 10-hour courses to vocational trades. And they noted that Hawaii is doing a really good job of this. And New Jersey also has a course about teaching students about health and safety in that workplace.
Oh, great. They said Hawaii and New Jersey. Okay, I'll make note. Yeah.
And then we also have another comment. Someone wanted to say thank you so much for this presentation. They join us from the California Healthy Nail Salon Collaborative and want to say thank you so much for your important work. They're also curious what sort of access nail salons have in Utah to chemical exposure trainings and education.
Yeah, you know, that's one of the things that we're trying to find out. So I think my understanding is not as robust as what it sounds like in, you know, in New York or Hawaii or New Jersey and Hawaii. And at the moment, it's not, my understanding is that it's not very accessible, and it's not quite on the radar as it is in other places. And that's kind of what we're trying to do with some of our trying to get going with some of our outreach is yeah, can we, I mean, we have, you know, we have CE and stuff at Utah too. Can we put together some things just for that population and get them targeted? Yeah, I think that's definitely the goal. And I don't think it's very, it's not very widely accessible at the moment.
Well, thank you so much for your presentation, for your research. I know I and many of the people on the call just want to reiterate that we really appreciate all the work that you're doing and bringing attention to this issue and sharing your research with everyone out there who's interested in it. So thank you so much for being here today.
Well, thank you so much for letting me to share what we do and what we're passionate about, and thank you for the great questions. It's wonderful. Yeah.
Excellent. Well, thank you also to everyone who joined us for today's webinar. The Education and Research Center Industrial Hygiene webinar series takes place the second Tuesday of each month. And the series is in addition to our ERC Ergonomics webinar series, which takes place the third Wednesday of each month. On next Wednesday, June 16th, we've partnered with the Midwest Center for Occupational Health and Safety for a free webinar on discovering the root of your backstory, understanding and preventing back injuries, and that will be with Dan Neenan and Linda Emanuel, RN. We'll also be taking a brief pause in the month of July, but we will be back in August. So be sure to check out our website for more information and to register for upcoming events at coeh@berkeley.edu/about-CE. And thank you all so much for being here. Thank you for the excellent questions. And a special thank you, Dr. Sleeth. We really appreciate you sharing.
Thank you.